Before we begin, please know that some episodes include language that may be sensitive for some people. Welcome to another episode of The Birth Portal. My name is Connie. Today's true story is my birth story. That was in 1993, pre-legislation of midwifery in Ontario. That didn't happen until January 1994. I learned there was one midwife in my town about a month before I delivered my son. I didn't have enough money to pay for her services at the time, nor did I fully understand what services midwives provide. 2 weeks before my due date, we were celebrating my in-laws' anniversary at my sister-in-law's place, who was an amazing cook. We were in her new home, and I was starting to contract while she was giving the grand tour. I couldn't do the stairs with the intensity of the contractions, although they were still coming irregularly. Throughout dinner, I found myself leaning to one side to relieve the pressure I was feeling in my vagina during contraction. I ate so much food that night, it was so delicious. I said to my husband on the way home, I might need to go to the hospital for an assessment if these contractions don't stop. When we got home, I thought I better pack a bag in case we do have to head to the hospital. I was excitingly packing my bag, and then the contractions spaced out and finally stopped around 11 p.m. I felt a bit sad as I was so excited to feel the contractions, thinking my baby was coming. Then I woke up at 2:30 in the morning with a stronger contraction than I had felt before. 5 minutes later, another one. This one made me sit up. Then 5 minutes later, another one just as strong. I woke up my husband and said, I'm going to take a shower and then let's head to the hospital. I called my mother and girlfriend to say, it's time. Meet you at the hospital. I asked my husband to write down the time of each contraction while I was showering. They had increased in frequency to every 2 to 3 minutes. Now I'm really getting excited. Still able to talk through them though, thinking, oh, this should be okay. Ha! Was I in for a surprise. When the nurse finally examined me at the hospital around 4 a.m., I was 3 centimeters dilated, so they admitted me. I was feeling rectal pressure with each contraction, and all I could think of was my cousin telling me she was so afraid of pooping in front of everyone during childbirth. So I asked the nurse for an enema, remembering how much delicious food I ate the evening before. But the nurse said, oh, it's just the pressure of the baby's head that you feel. My girlfriend and my mother sat at the small table in the room, and my mother would leave to pray in the waiting room or go have a cigarette to calm her nerves. My husband sat quietly at the bedside. All I could do was stand at the end of the bed, and with each contraction I would lean forward and move my hips back and forth, lifting one foot then the other. The nurse would come back in the room to listen to the baby's heart every now and then and tell me, slow your breath, you don't want to get dizzy. 3 hours later, the doctor came in to examine my cervix before heading to his clinic to see patients. He said, you're 7 centimeters, and I'd recommend a small enema, as he could feel the lower bowel was full. Thank goodness, I thought. I slowly climbed on the bed and would cry with each contraction wanting to get up, but had to wait for the nurse to return with the enema. Stimulating the bowels with an enema can cause more contractions because the nerves that stimulate the bowel stimulate the uterus. Castor oil is sometimes drank to start labor and causes the bowels to empty. I've seen some women within a couple of hours of taking the castor oil to begin to the delivery of the baby. Not an easy way to labor, as they were contracting so frequently, barely able to catch their breath before another contraction came. And to top it off, having to deal with the diarrhea from the castor oil. Please talk to your midwife or doctor before taking castor oil to understand the risks and the benefits. So after I'm given the small enema, I can't get out of bed fast enough, and quickly my body responds and empties. But the contractions hit me so fast and so strong, I can't even wipe my own butt. And I ask my husband to help, and he says, no way, that's not my job, and summons my mother to come and help me. I say, I can't sit anymore. And I remember reaching in the air saying, help me, I can't do this. And as I'm walking back to the end of the bed to do my back and forth hip dance, the nurse walked by the room where the door was left open and sees me suddenly starting to grunt. She does a quick about face and says, "Get back on the bed, and don't push. I'll call the doctor to come back." Inside I'm thinking, please, no, not the bed. I can't lie down. It hurts too much. It takes a few contractions to pass, trying not to push, at the end of the bed, and the nurse insisting I get on the bed while she quickly sets up the delivery tray of instruments. My mum is quietly praying at the table that this birth will be soon, remembering, I'm sure, how long and difficult her 5 births were being put out for the actual birth. Drugs causing twilight sleep were used in the 1960s when she had her babies. Finally, the nurse is gloved up and sitting at the end of the bed and says, "It's okay, Connie. You can push now. I'm here." I remember spit flying from my mouth as my body wanted to spontaneously push, and I was desperately trying to stop it until the doctor came. Finally, the doctor returned, and he brought another doctor needing training in childbirth with him. Now, I'm lying mostly flat on my back, with my girlfriend, mother of 2, holding my head up so I could see in the mirror. Suddenly, I feel like my insides are tearing when I push, and I hold back. I think, oh no, I'm going to need a cesarean section if I tell them the pain is inside. I quickly decide not to say anything is happening, and hope that they can fix the internal damage afterwards. My girlfriend gives me a bit of a shake and says, "Come on, Connie, push harder." After 20 minutes of pushing, I push with everything I have, and suddenly, my beautiful baby is born, and they place him on my belly. All that burning is now gone. I'm touching him gently. I can't believe how much love I have for him. And I say, "He's so small." And the doctor says, "Well, that's because you smoked." And I said nothing. The nurse takes him to dry him off, as that's what they did 30 plus years ago. After I delivered the placenta and the doctor is examining it, I ask him, "How does it look?" And he responded, "Well, it's small, but that's because you smoked." Okay, that's twice he said that, so I piped up and said, "No, I don't smoke." And he replied, "Oh well, I don't know then." He smelt the smoke in the clothes of my husband, mum, and girlfriend, and assumed I guessed I smoked too. My son was 5 pounds, 11.5 ounces at birth, and when I brought him to the doctor for his immunization shots at 2 months of age, he had rolls of fat on him. The doctor said, "Wow, you did a great job putting weight on him." Once I became a midwife, I requested a copy of my antenatal records where they document your blood pressure, your weight, growth measurement of the uterus, etc. And I realized I had IUGR, which is intrauterine growth restriction, because the uterus had stopped growing after 33 weeks. I also had hypertension. Although I didn't need blood pressure medication, hypertension can negatively affect the placenta by reducing blood flow to it, and therefore the fetus having the oxygen and nutrient flow impaired, which can lead to low birth weight and IUGR. I should have gone to the ultrasound the first time the doctor recommended it at 36 weeks, and I would have if I knew of his concerns. I was angry at first when I learned this, but at the same time not knowing let me go through the entire pregnancy stress-free, a double-edged sword. Ignorance was bliss. Knowledge is power. Thank you for joining me for another episode of The Birth Portal.